If you've been struggling with unexplained heart palpitation, stubborn high blood pressure, or health anxiety that seems to come out of nowhere, and you've been to multiple doctors who tell you everything looks normal, this video might be the most important thing you watch this year. I'm Juliet from Salis, where I work as a breathwork and movement expert specializing in mind-body synchronization. And today, I'm going to reveal the missing link that explains why so many successful, otherwise healthy professionals suddenly find themselves trapped in a cycle of heart symptoms and anxiety that traditional medicine can't seem to solve. Let me ask you something first. Does any of this sound familiar? You've had multiple ECGs, echocardiograms, stress tests, maybe even a heart monitor, and they all come back normal. Your doctor has told you it's just anxiety, or try to reduce your stress without any real guidance on how. You find yourself consistently checking your heart rate on your Apple Watch or taking your blood pressure multiple times a day. You've started avoiding activities you used to enjoy because you're worried they might trigger symptoms. You lie awake at night feeling your heart racing or skipping beats. Despite looking successful on the outside, you feel like a shadow of your former self. If you're nodding right now, I want you to know something important. You're not imagining these symptoms. They're real. And there's a scientific explanation for what's happening to you that most doctors simply aren't trained to identify. The problem isn't with your heart structure. The problem is with the connection between your heart and your brain, what we call the heart-brain axis. Let me explain what's actually happening in your body. Your heart and your brain are in constant communication through several pathways. First, there's the vagus nerve, the longest cranial nerve in your body that acts like an information superhighway between your heart and your brain. Second, there's your autonomic nervous system, which has two branches, your sympathetic fight or flight system and your parasympathetic rest and digest system. Third, there's your HPA axis, the hormonal cascade that releases cortisol during stress. In a healthy person, these systems work in perfect balance. But when you experience chronic stress, whether from work demands, health worries, or other pressures, something critical happens. Your parasympathetic nervous system gets stuck in this on position while your parasympathetic nervous system gets suppressed. Third, there's your HPA axis, the hormonal cascade that releases cortisol during stress. In a healthy person, these symptoms work in perfect balance. But when you experience chronic stress, whether from work demands, health worries, or other pressures, something critical happens. Your sympathetic nervous system gets stuck in the on position while your parasympathetic system gets suppressed. This creates a physiological state where 1, your blood vessels constrict, raising your blood pressure. 2, the electrical signaling in your heart changes, creating palpitations or irregular beats. 3, your brain becomes hyper aware of normal bodily sensations, interpreting them as threats. But here's where it gets really interesting, and this is where your doctor is missing. This creates a feedback loop. Your heart sends signals to your brain via the vagus nerve, and when these signals indicate stress, your brain responds by releasing more stress hormones, perpetuating the cycle. Even more fascinating is that what happens during the stress response, essential minerals like calcium and magnesium actually shift out of your bloodstream. This explains why many people experience tingling in their arms, extra heartbeats, or other strange sensations that can absolutely be terrifying if you don't understand what's happening. The medical system gap. So why isn't your doctor catching this? It's not their fault. They're doing exactly what they're trained to do. The tests doctors typically run, ECGs, echocardiograms, blood panels, they only look at the structural aspects of the heart. They completely miss the surrounding hormonal and inflammatory biomarkers that affect the heart-brain connection. And that's why you could have multiple negative tests and still feel terrible. Traditional approaches often fail because medications might address these symptoms temporarily, but they don't interrupt this feedback loop. Therapy alone might help with cognitive patterns, but it doesn't address the physiological mechanisms already in motion. Simply saying, reduce your stress without addressing the biochemical imbalances already happening is like telling someone with a broken leg to just walk it off. What's needed is a comprehensive approach that addresses both the physiological, the psychological aspects of this condition simultaneously. At Salus, we've developed the Calm Heart Method, a program specifically designed to address this heart-brain axis dysfunction. Our approach works in 3 phases. First, we provide immediate relief through our proprietary cardiac autonomic limbic modulation, CALM, reset protocol. It's a technique that resets the autonomic nervous system in as little as 90 seconds, ending those panic-inducing cardiac symptoms on the spot. Second, we identify and address the specific biochemical imbalances driving your symptoms through a comprehensive Calm Heart panel, measuring 17 critical biomarkers that conventional doctors typically don't test for. Third, we implement a personalized plan to rebuild the heart-brain connection, systematically restoring the balance between your physiological, hormonal, and emotional systems. This isn't just theory. We've helped over 300 clients completely eliminate blood pressure issues, health anxiety, and heart irregularities, as well as achieve remarkable improvements in energy, sleep, and quality of life. Just listen to what some of our clients have experienced. I went from daily panic attacks to completely eliminating my anxiety medication in just 9 weeks. I haven't had a bad anxiety episode since starting this program. That alone is huge. I used to be on edge all the time. Now I'm learning to reset my nervous system and finally feel calm again. Now, these aren't outliers. 91% of our clients report complete elimination of panic episodes by program completion, and 87% show normalization of previously elevated blood pressure. So if you're tired of living as a shadow of who you once were, I invite you to take the next step. In my next video, I'll share a specific technique for slowing down your heart and setting you up for a good night of sleep, something you can use immediately. But if you're ready for a complete solution, click the link below to schedule a consultation call. Now, during this call, we'll create a preliminary roadmap showing your projected recovery time that's yours to keep, regardless of whether if you decide to work with us. Remember, these symptoms aren't all in your head, and you don't have to live with them forever. There is a scientific explanation and a clear path forward. I'll see you in the next video.